I welcome the opportunity to speak to the motion and to support the motion indeed. Vision for Change, published in 2006, is a template for a community-based, progressive and modern mental health system. The policy emphasises provision of mental health system based on community services and supports provided by community-based multidisciplinary teams, with a significantly reduced need for inpatient services. 10 years later, there is a crisis in our mental health services, arising from and compounded by the abject failure to fund, resource, staff and implement the Vision for Change policy. This government again failed in Budget 2007 to address the resource issues needed for mental health services. In July of this year, the Department of Health stated that €35.4 million per year over the next 5 years was needed to implement the Vision for Change. Despite that, only €15 million was provided, a shortfall therefore of €20 million. The mental health services in my own constituency of Tipperary is a good example of the malaise in which the services are at both local and national level. Despite the best efforts of staff, the service is dysfunctional. In 2010, the Fianna Fáil Minister, John Maloney, decided to close our inpatient services for the county at St Michael's Unit in Clonmel, and his successor, Labour Party Minister of State Deputy Kathleen Lynch, implemented that closure despite the opposition of service users, carers, doctors, nursing staff and the public generally. South Tipperary inpatients were sent to Kilkenny, North Tipperary inpatients were sent to Ennis, and that was done in 2012. And the Minister sold the closure on the basis of a promised quid pro quo of a Rolls-Royce community-based service. 3 years later, we have the worst of all worlds. We have no inpatient service, community services are understaffed, under-resourced and underfunded, community-based teams are struggling to provide a safe service. They are deficient of staff all across all the categories of nursing, medical and paramedic staff. We have no 24/7 service. The new crisis house promise has not materialised. Patients are assessed in wholly unsuitable, busy and overcrowded accident and emergency departments with no privacy or confidentiality. The inpatient services in Kilkenny and Ennis are regularly overcrowded, and there is difficulty gaining admission and very often inappropriate early discharge. And we have the proposed closure of our unit at Mount Sion in Tipperary town. The situation is wholly unacceptable, Minister, and I call on you to immediately implement the Vision for Change policy in Tipperary, including the provision of 24/7 services, the recruiting of additional nursing, medical and paramedic staff for our multidisciplinary teams, the reopening of our inpatient unit at St Michael's Unit in Clonmel, and a commitment to keep the Mount Sion unit open. And I want to finally, acknowledge the excellent work being done by various voluntary organisations in the area of mental health locally. Organisations like the Consumer Mental Health Panels, Seesaw Suicide Awareness Group, the River Shore Suicide Patrol, Taxi Watch, Wellness Recovery Action Plan and Support Group, and the Carrick-on-Suir River Rescue organisation, and indeed many others. And finally, Minister, I want to urgently ask you to meet a deputation from Tipperary in relation to the services in the county.